Welcome back here. Do you suffer from any of the following? Headaches, migraines, neck and back pain, or how about pinched nerves? If you do, Dr. Devin has the solution. It's called NUCA, and here to demonstrate NUCA is Dr. Devin from Spinal Care of Nevada. Welcome.
Thanks for having us.
So what is NUCA? What is this we're talking about?
When I was in chiropractic school, I got smashed by a car, put in a ditch. I didn't want to go to regular chiropractic and have my neck twisted. So I found NUCA, and it's a very gentle method. It's a very specific way to realign the head and neck. You know, the head's about the size of a bowling ball. We get that where it needs to go. The rest of the body can balance underneath. So it can help with things like horrible migraines, which if you get a migraine, it's like you want the world to go away. All the way down to bad back, hips. You know, you wake up with a bad back every morning. It gets old. To pinched nerves, numbness, burning, tingling throughout the whole body.
I was going to ask you, what are some signs of pinched nerve? How does someone know if they have a pinched nerve?
Numbness, tingling, weakness in the arms, hands, or legs, pain, ache, fatigue, and sometimes it causes problems sleeping. So when you have a pinched nerve anywhere in the spine, our methods can get the pressure off without drugs, without invasive surgery.
This is amazing. And there's only like 200 people in the country that use NUCA, and you are one of those guys.
There's not a lot of us. It took a lot of studying, and when I first got adjusted, I was so thankful because I could barely button the on my shirt to go to clinic. I thought my career was in jeopardy. NUCA saved me.
We have it right here.
Okay.
How does it work?
So, NUCA is an adjustment to the upper part of the spine. This is an additional instrument in the office. It's called the arthrostim. The kids call it the woodpecker. And so we can come into a neck or a mid-back where you get pain or low back, and it very gently taps into the bones. So if you have a bad disc or arthritis, what we're able to do is get those bones slightly separated, get some circulation in, and get pressure off the nerves.
Now, if someone goes in with back pain, this is amazing. How long does a session take when you're doing NUCA?
Sure. Day one, we're going to do a thorough workup, what are called digital opposing view x-rays, best type of x-rays in our field. Day two, we're going to sit down and figure out how long it's going to take. I'm really upfront, and if you're like me, you don't like financial surprises, so how long is this going to take? When am I going to feel relief? You know, there's a type of patient who doesn't feel pain that sees me. We're preventive. There's a type of patient that's already having symptoms that's been putting it off. And if you have chronic intractable pain, call right away. There's always hope. Now,
what about children? Because there's children out there that have back pain from sports or whatnot. Is this for adults only, or can kids use this as well?
I have additional training in treating kids, and it's so gentle that we can treat very young children, teenagers, men and women with severe osteoporosis who've been told, listen, don't go to a chiropractor, who've been told they have to have surgery. There may still be help.
Now Dr. Devin, you're working on, obviously, the spine here. Are there other parts of the body? Because this is amazing. Other parts of the body that NUCA can work on?
Sure, and it's fascinating to fix the spine. It helps the nerves, and maybe it goes to the heart, the lungs, helps with breathing. There's studies we have that it helps high blood pressure. I don't claim to cure that, but as a byproduct of fixing the spine, helps the nerves down the hands, carpal tunnel, down the legs, sciatica, foot, ankle, hip, knee problems. I'm great with knees.
The latest thing, too, is it's called, what, tech neck? Because people are so looking down at their phones like this, and it affects your neck, it affects your spine.
And you develop what's called a dowager's hump. You see that, you know, sometimes much older people are bent over. We're getting it younger. I can help reduce that hump, better posture, stand up taller. Yes, look younger. Not that that's the most important thing.